Hi, Dr. Lindsey here. I'm going to take you through a healthcare professional who had 2,900 grafts 12 months and 1 day ago. And this guy is a challenge. He's got super white skin and super dark hair, class 6 hair loss, and his hairs are fine. And so no matter how many fine hairs you put on top of that pale skin of his, it's going to be good, but not great. Now, he has this massive beard, almost like Santa Claus. I mean, and those hairs are fat and curly. Unfortunately, he doesn't have those in his donor region. So he came in from out of state last year with his wife, who's also a doctor, and he looked like this. And I'd made him go home and decide whether he really wanted to do this or not. He needs a lot of hair, and he has a finite amount of hair, and he has the limitations we talked about. Ultimately, we agreed to do this plan, and we did 2,908 grafts on him. And he stayed for a few days, went home. He's a neonatologist, and so once the swelling went down, he was able to wear a surgeon's bouffant hat. It looks kind of like a shower cap in the intensive care unit, and resume his job, I think, around day 4 or day 5. That is not common. Usually you need a full week off. And his wife took out his stitches, and I didn't see him again until 9 months when he came in to talk about a second case. And so here he is at 9 months. He looks pretty good. And we decided to do a second case at a year and 1 day. So he came in and we did this brief interview the day before his surgery. Hi, it's Dr. Lindsey. I'm here with Dr. Gian Hernandez. It's okay to use your face and your name and everything, right?
Yes.
And how old a fellow are you?
I am 37 years old.
So when you came in about a year ago with your wife, I thought you were a class 6, not a great candidate for this because your hair is so black, it'll ultimately get gray because of that good looking wife of yours, and relatively fine compared to this rug that you got here on your chin. And you were probably a class 6 hair loss, and I made you go back to North Carolina and think about this, and then ultimately we did. How many grafts did we do last year? Do you remember?
Close to 2,900.
2,900. Yeah, that sounds about right. And so your before pictures are up with us, and that was a tough case. And you were kind of a nervous dude, and like all doctors are, we did one last week. It was at least as nervous as you were. And then I saw you. You sent me some pictures, and then I saw you around 9 months. And you look pretty good. And what is today? Are we right at 12 months? Or
right at 12 months.
Yeah.
It's the same exact day.
Yeah. Oh, same day.
Yeah.
Perfect.
The same day of the.
And so I think so you look good. Bend your head over just a little bit. Yeah. So you had no hair, and now you've got pretty good,
yeah.
but not perfect hair. And the reason it's not perfect hair is because number one, when you arrive on planet Earth, you have 100,000 hairs up here, and my best case scenario is putting, maybe 10,000 hairs there in 2 cases. And again, that color contrast, but that will fix itself as you age. And so I think our plan today is we're going to cut out your old scar, probably get somewhere around 2,500 grafts, and probably wind up with the same scar. Here's a picture of it after a year. And you haven't told me yet. I gave you this choice a couple months ago. We put them all in the back,
Yep.
or we put most of them in the back and a couple hundred at your hairline. And you haven't told me yet, but I would pick that because I tell most people, no matter how good it is, you always need a little bit more hair at the hairline, even if it's perfect hair, like this bushy stuff. A couple more hairs up there. You can't have too much hair at the hairline, but it'll be your choice. The downside of doing something at the hairline is that you'll have a little swelling. People will notice a little bit if we just do it in the back. Literally on 4 days from now, nobody on the planet's going to know you had this done if you're wearing your doctor and bouffant cap. Was I up front with you? Any kind of bullshit I pulled on you?
No bullshit, nothing. Pretty straightforward from the get-go, and basically the results that I got today.
Yeah, and they're probably going to mature a little bit more over the next 3 or 4 months. The final result on average is like 15 months. But nobody can remember and come back at 15 months. They've already forgotten what my name is generally. And so I try to get people to come right around a year. And generally it's about 85, maybe 90% grown. Sometimes 100% and sometimes 50%, but yeah, mostly grown at that point. How much did the whole thing hurt? Do you remember?
Well, no, not really. I will say that it hurt a little bit, but nothing like crazy. I think it was more nervous than the actual, I had more expectation towards the pain than what it actually was.
And
specifically after wars.
After what?
After the procedure was
Okay,
done.
afterwards, yeah. So, last night, I got an email from a dude in Tennessee. He's got a hand just like yours, and I had never heard from him before, but he said that he had gone to a place, and they talked him into doing an FUE to cover his whole head, and now at 13 months, he realized he's made a huge mistake. Did you try to talk me into an FUE, and if so, was I successful? I guess I was successful in beating you into a strip.
Yeah, and basically I mentioned it because I thought like what the procedure involved, and I thought it was going to be easier to do it that way and like healing faster and everything. But then you explained to me that but the amount of graft that I needed, it was not going to be so successful.
I think you pay more, it works less, and then there's not enough hair left for the second or third one of these if you need it. And in general, my philosophy is if your lifetime need's going to be more than about 2,000 grafts, I'm not interested in doing an FUE in it because it ain't going to work out enough to suit me and most likely you. And then if you need a second case, the poor fool that's got to do your hair transplant is going to be having big trouble getting hair out of your head. That was yesterday, last night. Friday, today's Wednesday. Friday I had a dude in that looks exactly like you, who's my age. He's a perfect candidate for a strip case. I showed him exactly his case, and he's wringing his hands about how much pain and suffering there would be with a strip case. And I had him meet 2 post-op patients and the patient in the OR. Can you reassure people really it ain't that bad, you know?
No, it is not. It is not that bad. And again, even like from taking painkillers and everything, probably the first night I took some painkillers, but after that it was not gone for me. Like I didn't have to take anything else.
Yeah. So first of all, thank you for coming. Thanks for coming a second time. I hope I get a picture of you about a year from now when we can do a really before and after 2 cases and have you completely covered. And in summary, if you just plan for the future and do a hairline that will age reasonably well and not do something down here, because one day you're going to be old and goofy like me, and you spend your hair frugally, generally we can make most people very satisfied with doing this. But you do your education, do your research, and if something sounds too good to be true, well, it probably ain't true. You should continue to do research. So ultimately, he chose not to put any hair at the left corner, and I think that's not how I would have done it. I think he looks good, but he would look significantly better had we put 300 grafts right here that allow him to get a little bit more density and conceal that really pale skin that he has. His wife is pregnant with their 3rd daughter, so she rules the roost, and she said she wanted them all put in the crown, and so we put 2,500 grafts in his crown, and I think he'll turn out great. He went back to work on day 3, again wearing his bouffant hat, carefully, taking care not to let it touch his grafts, and she should take out his stitches tomorrow, which will be day 6. And their plan is to have the baby, open a new practice for his wife, and then come back in 6 or 7 months and add 300 hairs to that corner. So we'll see how that plays out. I'd rather than wait a year so we can get good pictures and everything's healed up. Now, about the scar. Everybody's always worried about the scar. And in most of my now more than 500 YouTube videos, I show a close-up view of the scar. And the average scar on all comers that I get using a 2-layer trichophytic closure is about 1.1 millimeters. I get maybe 7 to 10 scars a year that are like a ½ millimeter wide, and you could have a buzz cut. And I get 7 scars a year or so that are really kind of crappy scars, and I've been very upfront about that. And everybody gets sewn up the same way, so it's how people heal. Everybody heals differently. And so when people are planning on a scar, I think you need to plan to have a poor scar and need a haircut maybe 5/8 of an inch long. But probably 96% of our patients can get by with a very short haircut and cover a 1 millimeter or 1.2 millimeter scar easily. And there's ultimately other things you can do. We can FUE into the scar at a year. We do have that 3 times a year on our own patients and 3 or 4 times a year on patients that come from elsewhere. But his scar at a year looks just like this. So people asked, does a second strip cause a second scar? And the answer is, Not at this office. At a lot of places, people will make a second cut and leave a second scar, but I find it hard enough to talk somebody into one scar. What, it's hard to talk. I think it'd be impossible talking anybody to a second or third scar. So we cut the old scar out at the second case. And then people ask, well, is it the top edge or the bottom edge or the middle? It really just depends on how you heal. And so on the doctor here, his scar was in such a position that really the best thing for him was just to cut the whole thing out. And the scar's right in the middle. So here's a picture of his strip scar before we started anything. Pretty small. It's really 1 millimeter. So it's just he's got white skin and black hair. Here it is on the strip. And it's pretty tiny. And then because he's a doctor, he wanted to know what it looked like underneath. And so I'm going to show you. If you do not want to see something that's gory, fast forward 10 seconds. So here's the undersurface of the scar. You can see it's tiny on underneath. And so that's where I sewed him together last year. And I would expect that he will get the same scar from this case. And so in summary, this guy is a challenging, not perfect candidate who really got a great result, who got a second case but still needs to add 300 grafts to his hairline. And I'm certain we'll see him back for follow-up and do those 300 grafts. If we can help you, please give us a call. Thanks.